This newspaper recently has reported some pretty horrendous occurrences of the county's mental health complex. These include sexual assaults, and what seem to be serious lapses in management and oversight of patients. You have criticized your Democratic opponent, Tom Barrett, for being responsible for MMSD overflows because he appoints 7 of 11 board members and because of his previous campaign promise. But MMSD is not a city agency and does not directly report to him. The complex, however, is a county facility run by a county agency. So what level of responsibility should people assign you for what occurred?
Sure. Anything that happens with the county, the buck stops with me. And that's why, in the end, there have been a series of changes, even in this past week. There's new leadership in terms of that administration, or in terms of the administrator at the Behavioral Health Division. There's staff that were identified in the reports this week who are no longer working there or suspended in the process of formally being terminated through the process that the county sets up. There are changes made even long before this, earlier this summer, that we made in terms of bringing in Barbara Beckert, who heads up Disability Rights Wisconsin. Anybody would argue it, one of the most independent advocates for people suffering from mental illness in the state. Her, along with Paul Lucy, who's got a stellar reputation in terms of public service and public health, co-chairing a panel to look at not just this specific issue, but a whole series of changes that need to be proposed in terms of acute inpatient care. We've taken responsibility for that, and we've taken action.
But if the buck, what I'm asking is if the buck stops with you, what should voters take away from those occurrences?
What voters should take, and let me finish this out. I'll give you a few examples, because they should look not only what's happening now, but what we've done in the past and how that translates into the future. Because if we said, oh, this is somebody else's fault, we're not going to take accountability for that and just let things linger like that after this story broke and the information was out there, then that would be a different opinion. But we've taken steps, and believe me, there will be plenty more in the coming days on that. You look back in similar challenges this county, either ones we inherited or some that came up over the past 8 years. 2004, family care program was just emerging. The state changed in terms of reimbursement. There were all sorts of problems popping up in terms of deficits that were projected in the family care program. County Board of Supervisors wanted Stephanie Sue Stein, the Director of Aging's head on a platter, wanted her fired, wanted her terminated. We stepped up and said, no, we can fix this. We worked on it. Today, we've not only eliminated the entire waiting list for long-term care services, which is what family care is all about in Milwaukee County. We're one of the few, if only, family care programs that's fully financially solvent in the entire state of Wisconsin. That was something where 6 years ago that was a problem. Today it's one of the greatest successes in the state of Wisconsin. You look at an area more directly linked to this that Meg was involved with, reporting on, the whole issue of people not having supportive housing in this community. Initially it would have been easy for the county to point at the city and say, city's in charge of public housing. The city could have pointed at the county and said, county's responsible for supportive services. Instead, the mayor and I got together and our staffs and brought other people involved. We tackled that challenge, and today there are hundreds of new supportive housing units in this community because we stepped up and responded to it. Now, at the time, in each of those instances, could you have said, yeah, can we judge you on those mistakes? Certainly, but more importantly, you should say, what did you do to correct them? What did you do when they came to light? What did you do when they were out in the open? What did they open to the public? And in every one of those instances, I mean, the list goes on and on. You look in so many other, you look years ago at the House of Corrections and the challenges that came up there. We worked on that and actually proposed something that literally should have been passed decades before I got in, but merged the House of Corrections with the jail and put that entirely under the control of the sheriff and gave him the tools and the authority to take care of the challenges in the Huber facility, at the House of Corrections, and in the county jail. All those things were successes.
In the mental health complex, why did the county not seek accreditation? Why did it let
2003?
Yeah.
Early on, because the process for that didn't add additional value to the patient care element. It's why in this past year we've started working for 2011 and beyond, preparing to do that, because they changed the process to add greater value to that.
And Cianelli was demoted, but still has a job. Should he?
I think in the end, I mean, in his case, the challenge there was not reacting to a past action. It certainly was for other staff that were more directly involved in those cases. The situation with him is, I didn't feel, not only because of what's happening now, but you've got the public policy working with a larger national organization on a major mental health review in terms of the whole redesign component out there that's going to be coming out in the next month. And if we're going to need to have fundamental changes, not only in terms of the county's role, but hospitals, community elements, staffing, all sorts of other ratios out there, to me, you can't do that with a leader who's under a cloud like that. There's got to be a complete change. And in the interim, there's going to have to be a temporary interim director, I mean, truly an interim director, to come in and help prepare for that transition after that report comes out, some other reports come out, so that you've got somebody who's got the confidence of not being dragged down by the problems of the past, but instead can look to the future. Long term, that's the only way you're going to get a permanent director in there who's going to have, you know, we could attract nationally, because nobody's going to come in on a permanent basis right now. You need an interim director who's going to come in and set the table for the sorts of long-term reforms that need to happen there and throughout the community, and you can only do it with a new leader.